African governments are being urged to strengthen data collection capabilities among nurses and midwives to highlight their true value in healthcare systems. At the first African Nurses and Midwives Confederation conference in Accra, Professor Wu Ying emphasized that nurses lack visibility despite their critical contributions. She noted, "Nurses provide essential interventions that physicians don't, and yet we fail to document our clinical impact and economic value. Nurses are central to primary health care, preventing infections, ensuring patient safety, supporting vaccination efforts, managing diseases, and addressing mental health needs throughout patients' lives." The WHO reports nursing professionals in Africa increased to 17 per 10,000 people by 2022, a 7.9% growth over a decade. Midwifery density doubled to 3 per 10,000. Despite this progress, the region remains far from the SDG target of 44.5 healthcare workers per 10,000 people. To enhance visibility, Professor Ying recommends developing PhD nursing programs, establishing research training, creating simplified data collection tools, and leveraging AI technologies.
Of the primary care are nurses and midwives, working within communities to keep people healthy and prevent diseases. They are also essential in ensuring the quality and safety of health care and preventing harm during medical care. And beyond that, nurses and midwives are essential in controlling hospital-acquired infections, leading efforts in fighting communicable diseases like COVID-19, running vaccination programs and tackling NCDs, and also promoting the mental health. However, when we are talking about nursing, we often focus on care. But nursing is also an economic powerhouse. Poor health and inadequate care come with huge financial consequences. Globally, poor health alone reduced the global GDP by 15%, and the COVID-19 pandemic cost the world $2.7 trillion, and the poor, inadequate health care systems result in lost productivities of 1.4 to 1.6 trillion each year, especially in low and middle income countries. So it is a significant impact on the global economy. On the other flip side, investing in health, especially in nursing and midwifery, yields significant returns. Data show that investing in safe, high-quality care saves 13% of total health spending due to treating harm caused by unsafe care, which is equal to more than $600 billion annually. And the data also show that there is a $2 to $4 in return for every $1 invested for better health care. Meanwhile, nurse turnover rates of up to 36% resulted in financial losses, with up to $36,000 lost for every nurse's turnover. So investing in nursing retention is not just good for patient care. It is also a smart financial decision. Now, you might ask, there's already a lot of data showing that the economic value of nurses, why do we still need more data to make nursing visible? What challenges have been seen as the caregivers and the assistant to physicians, primarily carrying out their orders? So as a result, people tend to consider patients' outcomes as solely driven by physicians' diagnosis and treatment. So consider Nightingale. If she did not have the knowledge and the skills to collect the right data, conduct rigorous analysis, and present it very clearly through visualization, her impact on reducing mortality rate might never have been recognized by the UK government, the physicians, and the public. So if we want the governments to recognize nursing's values, we must speak their language, data, and economics, with our local data that demonstrates the clinical and economic values of nursing. Additionally, because nurses' work is so closely intertwined with the physician's work, so it is often difficult to separate and collect concrete data that directly links nursing interventions to the improved patient outcome and the cost savings. So this brings the third challenge. We need to equip more nurses in each country worldwide with strong research skills. By doing so, we can generate more robust, precise data that directly links nursing to better healthcare outcomes and the economic benefits, making nurses' impact visible and undeniable. So, what are the strategies? Leadership is very important, and all of the nursing leaders I met are talking about leadership building. So I will talk about another competency that is just as important as leadership, which is researchability. As I said, if Nightingale did not have the knowledge and the skills to collect the right data, conduct rigorous analysis, and present it clearly, her impact might never have been recognized. From my own experience in China, one of the key strategies is developing PhD nursing education programs. These programs are vital in preparing research nurses who can conduct rigorous studies and generate more robust, precise data that directly links nursing to better health outcomes and the economic benefits. National nursing organizations could also establish training programs to equip nurses who are interested in conducting nursing research with research skills. By fostering a research culture, we can generate valuable data that can demonstrate nursing's contribution. And we also need to develop simple yet well-designed data collection tools and integrate them into daily nursing documentation. This allows nurses to collect valuable data while providing care. So, in conclusion, the visibility of nursing is critical for advancing our profession globally, and we are facing challenges in fully capturing and showcasing its value. By enhancing nursing education, equip nurses with research skills, improving data collection, and leverage technology, we can demonstrate nursing's undeniable impact on healthcare outcomes and the economy. Together, we can generate robust, more precise data to showcase nursing as a key force in achieving UHC and the SDGs, and driving the economic benefits, ultimately making nursing more visible.
When I was given this opportunity to make a keynote address, you know, as WHO, we usually have the documents, we have the reports, and I'm so happy the Honorable Minister mentioned the report I was going to dwell on, which is the upcoming report, which will be released in May, and what its contents are. So I won't repeat that. And as an old man, it gives me time to actually tell my stories. That's what I want to focus on. And the whole point I want to make is just in continuation to the beautiful lecture we just got. The contribution of nurses, of nursing and midwifery to achieving our health for all, which is the theme. Which, thank you so much, those who selected it, because it is very. I qualified in the 1990s. I see many were not born by that, or were still breastfeeding. But my journey of appreciating nursing and midwifery started when I was in medical school. I was taking it for granted because one of my mothers, you know, we have mothers in our families. One of my mothers is a midwife. She's in her 70s. She's still working, by the way, because even after retirement, she's still needed. But I was taking it for granted because she was my mom, and you know, they are telling you to eat what you don't want and all that. When we were in medical school, there is a rotation where you have to make, I think, a certain number of deliveries. And in our case, you are supposed, I think, to make at least 20 deliveries before you are signed off. And for some reason, when I was rotating, midwives were on strike. And as medical students, we almost had to become the midwives. Fortunately, we had, I will never forget this lady. She stayed around and guided us. And I remember one weekend, I was able to deliver more than 20 babies in one night, but with the guidance of that midwife. That was my first appreciation of the work of midwives. I qualified in the 90s. I'm sent to a hospital to lead a hospital which is at the border with Uganda and the Democratic Republic of Congo. I come from Uganda. I was the only doctor in the whole district, but there were nurses. There were midwives. And these ladies, they guided this young doctor on how to manage the three areas: leading, that is administrative, clinical work, and also continued education. They didn't stop there. They helped me in developing a proposal. I had never developed a proposal in my life because this was a really run-down hospital. We developed a proposal, and for the first time, the hospital was able to receive sufficient funding from a donor to renovate the hospital. That hospital still looks like that, the way we left it, thanks to the nurses who actually made me write that proposal to Irish Aid. Now, practically in the hospital, we were losing so many mothers, we got the midwives, we sat together and actually cut down maternal mortality in that facility. We cut down infant mortality in that facility. When I joined the district, all the indicators they talk about, antenatal coverage, immunization coverage, and so on, we wouldn't be there without the nurses actually taking on this. But as has been mentioned, for some reason, we do not bring that attribution to the front. I remember every year I would go to the national review meetings. I don't know how many of these, what do they call them, when you win something? Those plaques with my name, with my district. I was winning so many of these things, not the nurses. So personally, I know very well. Even when I joined WHO as an advisor on infectious diseases. All we are talking about, for example, coverage on antiretroviral therapy. I doubt if it would happen, the figures we're talking about, if the nurses were not the ones actually providing the service. I had an opportunity to go and review the South African program. We went to all the provinces. Everywhere we were going, it was the nurses that were holding the system. And I've also had an opportunity here in Ghana to visit some of the regions, some of the facilities. It is still the same story. We usually have what we call new kids on the block. These days, it is epidemic preparedness and response. In 2014, I was asked to go to Liberia to support the Ebola response. Colleagues from Liberia, I was sent to Grand Bassa. And when I go to Grand Bassa, and I'm telling you, in 6 weeks, we were able to bring down that epidemic. None of us as providers lost their lives. And I must attribute all that to the level of the nurses. COVID-19, we're talking oxygen, ICUs, and all that. And that are actually empty with all the wonderful equipment, because you do not have nurses to do the telemetry. You do not have the nurses to actually do the real care. But somehow we put emphasis much more on infrastructure. So that is my personal story. And allow me to just really add to the lecture we have had. And in my view, we need to use the data. We need to disaggregate this information. But especially in this day and age, we need to learn how to tell our story. It's not going to be told by anybody else. It's going to be told by the nurses themselves. So, all the things, for example, I've mentioned, they are not documented anywhere. But I happen to be just a speck in the whole global population of nursing world, assuming if we are able to document all this work. How come a nurse that has a master's degree is being paid less than a doctor with a bachelor's degree? It is because we've actually failed to bring out that visibility, to take on the roles of leadership, of decision-making. I know it is important for our bedside work, for our clinical work, but we really have to be at the table of decision-making. I'm looking at my friend, the director here, and I hope sooner or later you'll be the Director General. Now, back to the boring stuff. As of 2022, the number of nursing professionals in the African region increased to about 17 per 10,000 people, reflecting a growth of 7.9% over 10 years. The midwifery density doubled to roughly 3 per 10,000 people. The good words are the tripling, the doubling, but the actual absolute numbers are not exciting because the target we set ourselves to achieve SDGs is 44.5 per 10,000. So we still have a lot of work to do. And it's good what you presented. It's doable. It's been demonstrated. We've shown it here. And really, we must continue building this number. However, the challenges, you know them more than me. Apart from not having enough, many are unemployed. Nurses, I'm not a nurse, so I won't say we. Nurses are not represented proportionately at leadership level, and therefore there is that lack of visibility. And also the issue of salary disparities has already been mentioned. Ladies and gentlemen, as I conclude, I would like to emphasize that the WHO remains dedicated to continuing its collaboration with the leadership of the Nurses and Midwifery Council to ensure the achievement of UHC. On this note, I want to thank all nurses and midwives gathered here for your dedication, for your passion, and unwavering commitment to the health of our communities. I congratulate you on this significant milestone and wish you a successful conference. Thank you very much.
For us in Ghana, it's an honor for us to be hosting this conference. It has taken us time to plan for this. And we are only hoping that those who have come in, about 18 countries, and the leaders who are here will enjoy their stay in Ghana, take opportunity to see and experience our culture, our cuisine, and everything that Ghana has to offer. And most importantly, be able to go back and influence health and the health agenda of their various countries. Today, 21st, going forward, we are going to engage in our business sessions and discuss a lot of things. But the main theme of the conference is African nurses and midwives fostering health for all in Africa. Health for all means that we should be better placed as nations to make health accessible, affordable, and not be a burden, accessing healthcare not being a burden for the ordinary population. And therefore, our vision is to be able to position ourselves to engage with our ministries of health and be able to also motivate our colleagues to be able to spearhead health in their various countries. I'm Perpetual Foyampofo, and I'm the president of the Ghana Registered Nurses and Midwives Association.
As the conference brings together 17 African nations, it serves as a call to action for nurses and midwives to overcome challenges and work towards a healthier future for all Africans.